Hello and welcome to ANAT-AV. In this video, we'll be taking you through the anatomy of the ulna, focusing on site determination, special features, surfaces, attachments, and finally applied anatomy. Ulna is the medial bone of the forearm in the supinated forearm. It is a long bone. It has a proximal end, a shaft, and a distal end. We'll start off with the site determination. To orientate the ulna properly, one needs to distinguish between the proximal and distal ends, medial and lateral borders. This will also help you to figure out if it is a left or a right ulna as well. The proximal end is hook-like with its concavity directed forwards. The lateral border of the shaft is sharp. The styloid process is a posteromedial projection of the ulna at the distal end.
Now, let's take a look at the special features of the ulna. To start off, let's talk about the proximal end. The proximal end consists of two processes, the olecranon and coronoid, and two notches, the trochlear notch and the radial notch. The olecranon process enters the olecranon fossa of the distal humerus in extension. Coronoid process projects anteriorly distal to the olecranon process. The distal part of the anterior surface forms the ulnar tuberosity. Trochlea of the distal humerus articulates with this notch and makes the complex hinge-type elbow joint. The proximal part of its lateral surface is marked by the radial notch for articulation with the head of the radius. The radial head articulates with the radial notch, forming the proximal radio-ulnar joint, which is a pivot joint.
Now let's talk about the features of the shaft. The shaft is triangular in cross-section in its proximal 3/4, but distally is almost cylindrical. Its borders are lateral, also known as the interosseous border, which is sharp, anterior border, which is rounded, posterior border, which is palpable throughout its length. Between the anterior and the interosseous borders lies the anterior surface. Its medial surface lies between the anterior and posterior borders. Between the posterior and interosseous borders lies the posterior surface.
Moving on to the distal end of the ulna. The distal end of the ulna consists of the head and styloid process. Head articulates laterally with the ulnar notch of the radius, making the distal radio-ulnar joint, and is separated from the wrist joint by the articular disc. The short ulnar styloid process projects from the posterolateral side. Between the head and the styloid process, there is a vertical groove.
Now we will talk about the attachments of the ulna. So if we take the proximal end first, the triceps brachii is attached to the rough posterior 2/3 of the olecranon. The brachialis is attached to the anterior surface of the coronoid process, including the ulnar tuberosity. The supinator is attached to the supinator crest. The ulnar head of the pronator teres is attached to the margin of the coronoid process and the humero-ulnar slip of the flexor digitorum superficialis to the proximal end of the medial border. The annular ligament of the superior radio-ulnar joint is attached to the anterior and posterior margins of the radial notch. The capsular ligament of the elbow joint is attached to the margins of the trochlear notch.
Considering the attachments of the shaft, the flexor digitorum profundus is attached to the proximal 3/4 of the anterior border and medial surface of the shaft, arising medially to the olecranon and coronoid processes and to the posterior border via anaponeurosis. The pronator quadratus is attached to a rough strip on the distal fourth of the anterior surface. Flexor carpi ulnaris is attached to the medial surface of the olecranon process and to the posterior border. The extensor carpi ulnaris arises from the posterior border. The uncornice is attached to the lateral surface of the olecranon process and the adjoining posterior surface of the shaft. The narrow strip between the interosseous border and the vertical ridge gives attachment to the abductor pollicis longus, the extensor pollicis longus, and the extensor indicis. The interosseous membrane is attached to the interosseous border.
Moving on to the distal end. The ulnar collateral ligament of the wrist is attached to the styloid process. The articular disc of the inferior radioulnar joint is attached between the articular surface and the styloid process. Now we will take a look at the applied anatomy of the ulna. The cross union between the radius and ulna has to be prevented in an ulnar shaft fracture for pronation and supination. Dislocation of the elbow can occur in a fall on the outstretched hand. With the elbow slightly flexed, the olecranon process shifts posteriorly and the elbow is fixed in slight flexion. This disrupts the equilateral triangle formed by the olecranon process and the epicondyles of the humerus in flexed position. In normal extended position, these 3 points lie in a horizontal plane.
Fracture of the olecranon process is common and caused by a fall on the point of the elbow. It could also be subjected to aversion due to the forcible contraction of the triceps. Student's elbow or miner's elbow is caused by the inflammation of the subcutaneous bursa present over the olecranon due to repeated trauma. Maid-Lung's deformity is the dorsal displacement of the distal end of the ulna due to the retarded growth of the distal end of the radius. Here we reach the end of this video on anatomy of the ulna. Be sure to like and subscribe if you found this video useful and leave a comment down below and share with your friends. Thank you for watching ANAT-AV.